Hi, thanks for joining us for this episode of the Health Essentials podcast. My name is Cassandra Holloway, and I'll be your host. Today, we're talking about working through social anxiety and relearning face-to-face social skills as the pandemic nears an end. We're here with clinical psychologist, Dr. Dawn Potter. Dr. Potter, thanks for taking the time to speak with us, and welcome to the podcast.
Thanks for having me.
So the rollout of vaccines has obviously brought us hope, as well as some of the new guidelines for those who are considered fully vaccinated. And with this return to normal on the horizon for so many of us, you might find yourself starting to feel some sort of social anxiety after more than a year of virtual meetings and being in quarantine. So today we'll be chatting with Dr. Potter about social interaction and life as we know it as we learn to navigate this post-COVID world. So with that being said, Dr. Potter, I want to first start off by asking if you'll tell us a little bit about your practice at Cleveland Clinic and some of the types of patients that you see.
Well, I consider myself a generalist, so I'll really work with like most adults with most kinds of mental health or behavioral health problems. And but those problems definitely include things like social phobia, agoraphobia, which means the fear of being in crowds or fear, sometimes just fear of being outside the home in general, and obsessive compulsive disorder, which all three of those types of fears could cause people to feel extra nervous when they're returning to our new normal.
Yeah, so I guess I want to hit the ground running here. And, first thing I want to ask you, is it normal to feel this sort of anxiety about starting to see people in person again after we've been isolated for this past year? Are these feelings normal?
Mhm. Yes, I think it's definitely normal to feel some nervousness or anxiety, especially if you've been relatively isolated or in a small bubble during the pandemic and you're starting to socialize in larger groups again or socialize with people you haven't seen for a year or something like that.
What about feeling anxiety in general about the state of the world? Obviously, so much is still unknown and things change every day. Is it normal just to feel anxious about what's going to happen in the future or the future as we know it?
This past year has been, I think, a really difficult year, both because of the pandemic and also because of a lot of other types of social issues that have come up. And so a lot of people may feel nervous or anxious or have felt a lot of anxiety due to concerns about safety and things like that during the pandemic.
What exactly is social anxiety disorder? Can you talk a little bit about what that means and kind of what are some of the symptoms that go along with it?
Sure. So social anxiety disorder is um, broadly kind of just like sort of like it sounds, right? Like the experience of anxiety in a social context. However, it's more than just feeling a little bit nervous. So people with social anxiety will often worry that others will notice how nervous they're feeling. So they'll worry that they're blushing, they'll worry that they're sweating, they'll worry that they're going to trip over their words. People with social anxiety sometimes underestimate their social skills. So they feel like people are going to be laughing at them or judging them when oftentimes they're not. So there's a lot going on in the mind of a person with social anxiety, which can be, distracting and make it difficult for them to actually engage effectively in a social situation. It can be limited to certain settings like um, public speaking, or it can be more broad where it applies in a lot of social situations anytime you're not with familiar or close people.
Is there a difference between stressing about, how we'll react when we see people for the first time in a while and then stressing about like the germs that have been associated with COVID and kind of that OCD kind of thought pattern?
Yeah, there's definitely a difference. So with social anxiety, a person will be more likely to be worried about doing something right. So they may stress about something similar to what a person with OCD might stress about, like, oh, am I supposed to hug them? Am I supposed to do a handshake? Am I supposed to do an elbow bump? Or how close should I stand to them? However, the person with social anxiety will be worried about, not getting the social norms correct about making a misstep and not knowing what to do. Whereas the person with OCD may be much more concerned about like what's safe and not safe. Am I going to make the right choice?
What advice do you have for people who are stressing or anxious about the change to their routine or just starting to see people again? Maybe they've been working at home for the past year and their routine has been very, scheduled. And now they're starting to come back into the office. Kind of what advice do you have for people to work through this anxiety?
if your schedule is dictated by your employer, you may not have this flexibility. But however, if you do, try to take it slow. If you can start out going back to the office 1 day a week, if you haven't been going into the office at all, and just see how you feel. People may find it, more tiring when they start to do these things that they haven't been doing because of trying to like relearn all those little social things that they haven't been as active with. Luckily, relearning stuff is much easier than learning it for the first time. So, so I think that people will bounce back faster than they may worry that they will. The other thing I would say is just like take care of yourself beforehand. So um, oftentimes when I work with individuals, we want to talk about the concept of coping ahead. So if it's Sunday night and you know that Monday is going to be your first day back in the office, make sure have a healthy meal, go to sleep early, avoid alcohol, avoid things that might make you, not feel great the next day. Try to take it easy the day before you have something big going on so that you like start off on the right foot.
What about when it's time to like seek help from a mental health expert or just seeking support from those around you? Kind of what advice do you have for that?
So some nervousness may be totally normal, and again, it will probably go away pretty quickly, like maybe after a couple days back in the office. However, if nervousness persists or if it interferes with concentration, if it makes you feel symptoms of panic, which means having trouble breathing, having your heart racing, feeling shaky, feeling faint, that may be time to talk to your doctor or talk to a mental health professional. um, Milder symptoms of anxiety, you may benefit from just social support, talking to somebody close to you, maybe just talking to other people about like, how did you feel the first time you got back in the office? What was that like for you? How did you deal with it?
Yeah, I love that advice. Kind of just reaching out to those around you and really just going slow, working on your routine, like you said, showing yourself some compassion. And I love the fact that you said, it's usually a lot easier than people think, and we relearn a lot more quickly, the second time around.
Yeah, even with social anxiety, anticipating something is often worse than the actual event itself. Again, some nervousness is normal. However, you need to remind yourself that it's not going to be as bad as you think it is. When we're nervous or anxious, we anticipate the worst, and the worst rarely is what actually happens.
Right, exactly. So with people, obviously going back into the office maybe 1 or 2 days a week and kind of starting to take it slow, like you recommended, if they can, what should we know about that office chit chat? When we used to, water cooler talk and talking about the weather in the office with someone. Many of us have missed out, obviously, on those little conversations over the past year. Is office chit chat good? And what should we know about kind of just the mental health aspect of having these small kind of conversations?
Yeah, I definitely think it's good. And I think that, you know, individual differences will vary based on personality dimensions like introversion and extroversion. So extroverts maybe get much more energy and value from office chit chat. However, I think even people who are more introverted and are a little less like outgoing, probably it's one of those things where we don't really know how much we missed it until we get it back.
And then what's your advice for kind of that office or work gossip? Obviously gossip is a quick way to vent or to bond with
Mhm,
people. But obviously it's not the best case for conversation and for a
mhm,
work environment. So what's your advice for gossip versus kind of establishing those personal connections again to really work on your bond with your coworkers?
mhm. Yeah, that's an interesting question. Well, I guess if you're if you're in a conversation with another person and the two of you are talking about somebody that isn't present, I think you need to always be kind of thinking about your intentions. So when we talk about somebody else when they're not there, it definitely has the potential to go into gossip, especially if our goals are to make light of somebody else's problems, to be making fun of them, stuff like that. However, if you're talking about somebody else who's not there with a sign of concern, or with like, wow, did you hear what so and so did? That was such an awesome project that they worked on. That would be great. Sorry. But like, so I think thinking about like always just thinking about like what is my intention when I'm talking about this person who's not here to give their own perspective.
Yeah, that's a good way to think about it for sure. What about kind of just reestablishing healthy conversation practices, like not interrupting each other? Obviously, a lot of us have been on these virtual meetings where it's kind of hard to tell when the next person is going to talk. So there's a lot of, conversational interruption or
Mhm.
just the use of like tone or taking a breath before someone speaks. Kind of what tips do you have for just reestablishing those normal conversation practices that we haven't been able to do for the past year?
I think that that's one of those things that will probably, again, come back pretty quickly as we get used to it. I suppose one thing that may be different is for people who've been very isolated, who maybe haven't been doing as many like professional meetings, is reminding yourself of like the setting that you're in. So we've a lot if a lot of us have been working from home, we're probably dressing more casually. We're probably, mostly interacting with the like friends and family where we're going to be using language that we wouldn't use in the workplace, or just speaking about things much more maybe personal, or not like it's just a different kind of conversation. So trying to get yourself back into that vibe of like, I'm in the workplace now, like what would I really share with so and so that I don't know super well.
Right, it's kind of like that advice, like, read the room and kind of act from there.
Exactly, yeah.
Okay, so what about dealing with people who might be, like, rude and aggressive in these situations, who are just kind of feeling that angst of the pandemic? Obviously, we've all
Mm-hmm.
been through a lot this past year, and those people who are just angry about how things turned out or just, acting aggressively, it feels like people's boundaries have sort of shifted, and they will act or say things that they wouldn't have previously said. Is that normal? And then how do we go about kind of working through this aggressive behavior, I guess, from strangers or coworkers? Kind of
Mm-hmm.
talk about that a little bit.
Yeah, that's a really interesting question. I The question of is this normal, I think depends on like the degree of the aggression, and also whether it's normal or not. Is it okay? Is it healthy? Is kind of a separate question. So when people feel afraid, often they do that fear does come out as anger. And the uncertainty of the last year, I think, has been really difficult on a lot of people, and uncertainty frequently causes fear and anxiety. And so is it normal? Yeah, probably a certain degree of anger and frustration is normal. However, if a person is unable to sort of control how they're expressing that, and that's hurting other people's feelings, just because it's normal doesn't mean it's okay. And so so if you're on the receiving end of aggressive or inappropriate communication, it can be tough to know what to say. And usually I recommend being pretty direct, but centering what you're saying on your own feelings. So rather than being like, you're being really rude right now, because that can feel uncomfortable to the person saying that. They don't want to escalate the conflict. You can say, hey, I don't know if you meant that way, but that really hurt my feelings. Like, that was pretty intense what you just said there. Centering it on yourself and how you feel rather than on them in a way that might make them feel defensive if they're already like upset or frustrated. And the other thing when dealing with somebody who's very upset, there's a conversational technique called disarming. So you can try to validate something from their point of view, even if you don't agree with their point of view, because we can't always agree with everybody on everything. However, we do still probably want to keep a cordial relationship, right? So if you disagree with someone's point of view, but you can agree, like, yeah, that must have been really frustrating for you. You express empathy for that. So we don't be dishonest when we're trying to empathize with somebody, but we try to validate something of what they're saying, and that helps sort of take the wind out of that person's sails, so they don't feel as aggressive because they're not still trying to make their point because they feel heard.
Yeah, like you said, you kind of disarm them and then you kind of start that open conversation, like get to the root of the problem. What really is wrong here? What can we do?
Mm.
So, what about greeting people in this post pandemic kind of world? Whether it's a handshake or even a hug, how do we navigate these situations if we're uncomfortable still with kind of starting that physical touch at this point?
Mhm. Well, I think the first thing is to really be kind to yourself and respect your own boundaries. So a lot of people are going to have different viewpoints on what's safe and not safe. And you know, I would say if you feel pressured to be closer to somebody, to greet somebody in a way that you're not comfortable with, don't push yourself. Be brave and try to get out there in general, and socialize within like the realm that you feel is okay. However, if somebody goes in for a hug and you're not okay with it, you kind of do the it's not you, it's me thing. Like, I know you're vaccinated and you probably don't have COVID, but I'm just not ready yet. Like, I just don't feel comfortable, and you just, again, you own your feelings. You don't put it on them.
Yeah, I love that advice for sure. What about, people who are heading back into work or just a social setting, meeting friends, here and there, people who are worried about this idea that they don't really have anything new or exciting to talk about. Maybe they feel that, for the past year, nothing has really happened to them. They've had a
Mhm.
repetitive and kind of boring experience. What types of things can people say or ask, or I guess even prepare topics for to have at these conversations and these get togethers?
And I think that's something that's going to be really common that people are going to be feeling. And um, I would say one thing is, even if a person feels like they didn't do anything exciting over the last year, or whichever, they probably did. They're probably sort of discounting themselves and their own experience. And also the frustration with, I think, the boredom and the sense of like being cooped up that a lot of people have really, really felt because they haven't been able to do the same type of, travel or sports or whatever they would normally like to do that would have been dangerous. However, they probably still did do something. And so don't discount yourself. Number two, though, if you really can't think of anything that you want to share, then you can shift the conversation to like, now that things are opening up again, these are the things I'm still wanting to start doing again. I want to start playing tennis again, or I want to start, you know, traveling to such and such place that I used to always go, or I'm so excited to get back into this group that I used to be a part of and do these meetings and or my book club, like talking about the future. And I think that's everybody kind of wants to feel more hope. So I think that's a great place to start.
Yes, I love that advice. And also just kind of talking about, what you went through in quarantine, I feel like is a big kind of bonding aspect, whether you're kind of venting together or talking about, oh my gosh, I can't wait to go to this restaurant, like you're saying, or just kind of future plans. But just we all kind of suffered through this together, obviously in varying different degrees, but we did do it together and we kind of all went through it at the same time. And I think that says a lot. So what about avoiding the awkward silences? Like what can we do if we find ourselves in these situations panicking that we cannot find anything to say? Do you have any kind of advice for those awkward moments?
Yeah, I think remembering that there's always two people in the conversation. So each person shares 50% of the burden of filling that airspace. And then secondly, usually if it becomes uncomfortable, pointing it out diffuses that tension like, oh well, I guess we've talked about everything we need to talk about. Or well, yeah, I really really don't know what to say here. And that usually the other person is kind of like, oh, thank God.
Yeah,
Because
just
I didn't know what to
addressing
say
it.
either.
Yeah, absolutely. Yeah, just addressing it kind of makes it less
Hmm.
awkward, I feel.
For sure.
Do you have any advice for interacting in person with someone for the first time who has differing opinions than you? How do we prepare for those uncomfortable conversations?
Yeah, that's something that I think a lot of people are probably going to be facing, no matter what their opinions are. And so there's kind of two facets to that conversation when it comes to just the theoretical nature of like, should we have been wearing or not wearing masks? Do we believe in COVID or not? I think it's a personal choice of how much you really want to get into discussions and debates about that. And that's kind of just one thing to remember is if you do want to get into it on that intellectual level with somebody who disagrees with you, always try to be respectful, hear out the other person's side, validate their point of view, even if you don't agree with it. And that helps keeps discussion civil. When it comes to somebody with different opinions on the pandemic than you, whose behavior is maybe making you uncomfortable, then we need to think about like communicating assertively and centering the conversation on ourselves and our needs versus trying to take care of that other person's feelings. So when we talk about assertive communication, which is what is needed in those type of situations where somebody's pushing on our boundaries, maybe because of different beliefs, then we need to stay away from both passive communication on one end of the continuum and aggressive communication on the other. So passive communication would be things like shifting uncomfortably in your seat when somebody's standing too close to you, or just kind of moving away a little bit, or just sort of walking out of the room, because that doesn't necessarily teach somebody that what they're doing is making you uncomfortable. People don't necessarily pick up on passive cues. On the other hand, being like, back off is maybe not effective in the workplace or with a boss or a supervisor, and it's not going to make you any friends like in other social situations either, right? If it's with somebody where you really want to maintain a relationship. So aggressive communication, as the opposite of passive communication, kind of centers on your needs without regard for the other person's, where passive communication is really trying to put that other person's needs and feelings first. You don't want to hurt their feelings. You don't want to say, hey, you're making me uncomfortable. Assertive communication lands us in the middle, where we respect ourselves by respecting our own boundaries and putting our own like feelings out there in an appropriate way. We also respect the other person by not sort of like bowling over them or making unreasonable demands. So it is not unreasonable if you are returning to work and you're feeling uncomfortable because somebody's standing too close to your desk to just say, hey, like I'm really not ready for that. Is it okay if we just keep doing a little bit more social distancing in the office as I get used to it? It's I know you don't mean any harm, however, like I'm uncomfortable. Or if somebody wants to do a handshake or a hug, again, like I said before, it's okay to say, you know what, let's just wave, or let's just do an elbow bump, or I need time to work into it, right? It's not that you're doing something wrong, it's okay for you, however it's not okay for me.
So, from a psychological perspective, overarching, do you think that most people will be dealing with the mental health repercussions from this pandemic for, the rest of their lives or for the next couple months or years? Kind of what's your kind of professional opinion on just like the mental health repercussions of everything that has happened
Mhm.
collectively over the past year?
It would be hard to put a timeline like broadly, because even though we've all been through this together, for some people there's been much more loss, there's been much more trauma, and for others it has honestly been easier. And so, you know some people, I don't think anyone will forget, right? No one will forget the pandemic. However, people can recover from loss and trauma, and they can also show resilience, so that even if they go through something really difficult, they may not show clinically significant symptoms. And we also have a concept of post traumatic growth. So many people during this time may have found new strengths that they didn't know they had, or built new coping skills that they were never forced to use before, that will carry them through. So people could come out of this stronger. Some people will come out of this continuing to be depressed, continuing to be anxious. And if that's the case, then, seeking like medical care, seeking mental health care is the best thing to do, because treatment is out there, and most people can recover from many things.
I'm curious, do you think that people will burn out more quickly after the pandemic is over? We always hear about like work burnout and
Mm.
working yourself to the core, but since we aren't used to that busyness or the demands of what life used to be, do you think people will kind of have a shorter burnout time?
I think it's totally possible. Yeah. I think, again, it's going to depend on the person and the personality, because for people who do tend towards being more introverted, being more like maybe having social anxiety or having some social anxiety type of tendencies, even if they wouldn't be like in that clinical zone of social anxiety, they may burn out more quickly because it would take a lot of emotional energy to kind of reintegrate. However, people who are more extroverted and who, really thrive on like social interaction and get energy from being with other people, from being in busy settings, people may they may find that they actually burn like the opposite, like they are more energized, they're more productive now that they're able to return to the office versus when they're just stuck at home, like working alone or working with like phone or video meetings interspersed, right? So I
Sure.
think it could really diverge.
And then do you have any like warning signs or symptoms that we should look for if we are doing too much too soon? I know your advice was to kind of take things slow, but if we find that we've gone too fast, kind of what are some of those warning signs that we should be on the lookout for?
I think excessive fatigue, um, having trouble enjoying things, feeling down or depressed, having trouble with motivation outside of work could be a sign of of doing too much, having trouble concentrating, any of those anxiety symptoms that we've already talked about as well, of course.
Do you have any advice for people whose jobs never slowed down? Maybe they are an essential worker, they've been working nonstop since the pandemic started. Kind of what advice do you have for them about just taking care of their mental health and avoiding this idea of burnout?
I think, and I mean, burnout in the medical professions and other essential workers is like, like a huge concern right now. And I would say, if you have vacation days, take them. If you can take them, take them. You need time for yourself to recover. If you can't, you need to be being honest with supervisors. Oftentimes burnout, like job related burnout, is caused by systems problems. And during the pandemic, there weren't a lot of choices. Like, you know, some people just couldn't take time off. There was a shortage of health professionals to take care of sick people, right? And as things get better, there will hopefully that will get better. So
Yeah,
being
and
honest and being real with supervisors of like, no, I really need this day off. Like I'm really getting burned out. I'm really having trouble. I'm afraid it's going to impact my work. Like it's scary to say that stuff, but you need to.
yeah, just being an advocate for yourself and your mental health. And then the whole idea of obviously self-care comes into play. How do you recharge? How do you feel better so that you can show up every day to work as your best self?
Exactly.
So I keep reading about how the 1920s followed the 1918 flu and how, the roaring 20s was this era of social interaction and parties and dressing up.
Mhm.
Do you think, on the opposite end of the spectrum of what we've talked about today, that the pandemic will motivate and inspire some people to get out there more and kind of experience life more and meet new people?
Mm, I hope so. I mean, I think that sounds like it would be pretty positive on the end of what we've all just been through. I wouldn't be surprised. It'll be interesting to see what happens.
Yeah, absolutely. So, my last question for you today then is, what parting advice do you have for listeners about moving past the nerves and anxiety, about returning to life and starting to interact, face to face with people again? If you could give them one piece of advice or encouragement even, what would you say
Mhm.
to our listeners?
I would say, you know, be brave, put yourself out there within what your boundaries are in terms of safety. There's been a lot of news about these new variants, and we know that vaccines are great and effective. However, if you are still concerned, then know what you're okay with and stick to it. But be brave and remember that humans are social creatures. Human beings have been through other pandemics. Human beings have been through a lot of different things, and we are wired to connect socially and to adjust to different social settings. Big social changes are hard. So the shift that we did make with this pandemic was hard. And so a little bit of nervousness, a little bit of difficulty bouncing back is normal. However, your skills are probably going to return much faster than you think they are.
Wonderful advice to end on. Dr. Potter, thank you so much for being here today and sharing your insight with us.
Thank you.
To learn more about mental health, visit clevelandclinic.org/behavioral health.